6 medical conditions that can prevent pregnancy without obvious symptoms. Pay very close attention to this video if you really want to get pregnant. You may look completely healthy and have a regular period, yet struggle to get pregnant. So in this video today, I'm going to give you 6 health conditions that doesn't have obvious symptoms but can affect fertility. The sixth one is the most important one. Nurse Magwise, your daily dose of truth for a healthier life. I make medical educational videos every day. So if you're a first time mom or if you're trying to get pregnant, okay, or if you like health talk, just subscribe to my YouTube channel. You're going to be learning a lot of things that will help you live a healthier life. Even though you are trying to get pregnant, with the things I'm going to be teaching you on daily basis, you can achieve pregnancy and carry your baby. So let's dive into the video. Number one health condition that can prevent pregnancy without obvious symptom is blocked fallopian tube. The fallopian tube is a place where the egg and the sperm meet for fertilization. But when the place is blocked, there will be no entrance for the sperm to travel and meet the egg for that fertilization. And without that meeting, there will be no fertilization. Then without fertilization, there will be no implantation. Without implantation, there will be no pregnancy. Pregnancy is a process. Without this process, there will be no pregnancy. The most annoying thing about this fallopian tube is that the fallopian tube can be blocked for a very long time without any symptom. Most women only find out when they have tried for some time and pregnancy is not coming, and then they will go to a fertility specialist or a gynecologist, which we suggest they should, go for some medical checkup before they will now find out that the fallopian tube is blocked. So in most women, in most of the cases, there is no obvious symptom when the fallopian tube is blocked. The second one is ovulation problem. You can have menstrual bleeding every month without releasing an egg. Yes, it's very, very possible. Conditions like PCOS, polycystic ovary syndrome, thyroid disorder, or elevated prolactin, all of these conditions can interfere with ovulation, making conception very, very difficult. So most of these health condition does not have obvious symptom apart from prolactin, elevated prolactin that can cause you to have breast milk. Do you understand? Or breast pain, depending on the patient's health system. A woman can live for like 5 months without releasing an egg and there will be no symptom. You feel normal, you feel okay, but you don't know that there is no egg. And without the release of an egg, there can never be fertilization. And without that, there will be no pregnancy. That is why I told you that pregnancy is a process. Do you understand? The third condition is endometriosis. This endometriosis is a condition that occurs when the tissue, similar to the lining of the uterus, grows outside of it. Some women with this health condition have severe pain, while others have a very mild symptom. But there are other women that doesn't even have any symptom at all. But when they go for medical checkup, the results will uncover that they are in this health condition. And the worst part about this endometriosis is that it affects reproductive organ, especially the fallopian tube and the ovaries. And when these reproductive organs are affected, conception will be very difficult, except the health condition is treated very well. The fourth one is uterine abnormalities. Now, conditions like fibroid, especially the one that distorts uterine cavity, or congenital abnormalities All of this can sometimes interfere with implantation. And when that happens, pregnancy will be almost impossible. I told you that pregnancy is a process. Without fertilization, there will be no implantation. Without implantation, there will be no pregnancy. So this condition now can interfere with implantation. And when that happens, you know what it means. The fifth one is male factor infertility. Now, people need to understand that about 40 to 50% of infertility cases involve a male factor. And the worst part about all of this thing is that a man that looks very healthy, especially those ones that goes to the gym, look very healthy and handsome, they can look all healthy and be very good in bed, and yet they are not fertile. This one is very, very important. A semen analysis is an important medical checkup to know the fertility status of your partner. Fertility is a shared responsibility. It's not just the responsibility of the woman. So please let all of this medical checkup take place before you blame your woman, because no matter how healthy the woman is, if a man is unhealthy, pregnancy will not happen. No. The sixth one, which is the last one, is thyroid disorder. No one talks about this because it does not show obvious symptom. But you need to know that overactive or underactive thyroid can disrupt hormone balance. It can disrupt ovulation, your menstrual cycle, and make pregnancy so difficult if it is left untreated. I'm taking my time to explain this because I really want you to get pregnant this year. And because you're subscribing to my YouTube channel, you're definitely going to get pregnant this year. All of these health conditions are hidden reasons why many couples are yet to have their baby. So please go for medical checkup and look out for all of these health conditions. Handle them very well, and you will have your baby this year. Okay. Thank you for watching this video. It's me, your daily dose of truth for a healthier life. If you've been trying to get pregnant for years, for for 6 months, 12 months, for many years, and nothing is happening, and you need my guidance, you can book a private section with me. You can send me an email on ymagnify@gmail.com. That is my email, or you can call the number on the screen to book a section with me. Okay. Thank you, and see you in my next video.